Hi, I'm Marvin Plackett, and today is Monday, December 14th. Greetings to all residents, to all staff, and to all guests. Hope you're doing well. I hope that you had an enjoyable and safe weekend. Currently, we have 27 active COVID cases at this time. You will recall when I was last with you that we had, I believe, 22, so we're at 27. 12 of those are residents and 15 are staff. The residents are either at Episcopal Church Home or at Cardi Heights or at Iris Park Commons. The staff, of course, they've worked in a few different places and they are at home recovering at this time. So it is troubling, of course, that the numbers continue to increase for us just a little bit more every couple of days. And of course, it's a reflection of how much the virus is surging around us. It's really a rough period. It's terrible right now in terms of the surge of the virus, not just, of course, in the Twin Cities, but throughout Minnesota and throughout the U.S. But that's the reality right now. So once again, we have 27 active cases at this time. In the news, you're reading, you're hearing, etc., a lot about the vaccine. So let me talk briefly about that because more and more questions are coming in. We don't have all the answers yet by any means, but I can tell you what we do know. First, at Episcopal Homes, we fully endorse this vaccine. We fully embrace it. We fully support it. So as soon as it becomes available to all of us at Episcopal Homes, we are going to, of course, readily take that vaccine. As you know from the news, the Minnesota Department of Health has adopted the recommendations from CDC in terms of the priority order. So those living in long-term care are going to get it first. Who's in long-term care? In Minnesota, that's defined as nursing home population and assisted living. Because of course, the frailest in our society are in nursing homes and assisted living. So here at Episcopal Church Home, at Episcopal Homes, it is Episcopal Church Home, the Gardens, and Iris Park Commons. So that's the first group that's going to get it. Now within that first group, are staff going to get it first or residents get it first? I'm not sure exactly how that's going to go. I think it's going to be residents first and then staff. Then after long-term care gets the vaccine in the first grouping, then it is going to roll out amongst other priority groups and then ultimately to the entire population of the United States. We, of course, don't know the answers yet of when the first group, long-term care, that is our residents at Episcopal Church Home, the Gardens, and Iris Park Commons, we don't yet know when it's going to be delivered, when we're going to actually be vaccinating, but we will keep you informed, absolutely, just as soon as we know. And then in terms of, we have 7 then independent communities. We have the Terrace, we have Midway Point, Seabury, Cornelia House, Cardi Heights, Kings Crossing, and Beckettwood, and so forth. So of our 7 independent communities, we do not know when you are going to have it made available to you. So we're going to let you know as soon as we know, okay? So that's, let's see. Then I wanted to read a quote from today's Star Tribune. They, in fact, inserted an article from the Washington Post, front page of the Star Tribune. The title of the article is First Vaccine Shipment on Its Way. And I just want to read one sentence from that article. Despite the rapid rollout of the Pfizer vaccine, it will be months before immunizations have any effect on the pandemic in the United States, where case numbers are surging. So while we are going to be early in the process of getting the vaccine, as I just explained, before society goes back to normal, it's going to be several months. And so as a result, we need to remember for today and for several months that the key words of caution are stay vigilant with the practices that we know to employ. It's absolutely vital that we not let up at this time. The virus is surging. We have to be more vigilant now than ever, and that is with wearing a face mask at all times when we're not in our apartments or not in our units or rooms or our offices. staying at least 6 feet apart. Whenever it's possible, staying at least 6 feet apart. Frequent hand washing, and if you have any symptoms, isolate and get tested. Those are key things that we can all do. We need to do it for your safety, for my safety, for the safety of your loved ones, all right? We need to do it for one another. We're all in this together, so it's really vital that you keep those things in mind. The vaccine is extremely hopeful. We're thrilled. We're excited. We can't wait. But it's not here yet, and it's going to take several months. As I read from the article, it's going to be several months before, as it says here, before immunization will have any effect on the pandemic in the U.S. That's the reality. It's going to take a while. But there's hope. There's light at the end of the tunnel. That's the great part. Okay, want to read you once again the birthdays for this week. Clarice Vold at Seabury, Henry West at the Terrace, Richard Holmes, Cornelia House, Roosevelt Turner at Episcopal Church Home, Norma Bond at Seabury, Carl Lindell at Seabury, Norma Bond at Seabury, Carl Lindell at Iris Park Commons, Jacqueline Polk at the Gardens, Jewel Jones at Midway Point, Kashun Chang at Seabury, Alice Johnson at Seabury, and Cheryl Brando at Midway Point. Happy birthday. Hope you have a super day. All right, everyone. Take care. Be safe. Be vigilant. And remember, feed your soul. All right? Find a way to make somebody else happy. Make someone else's day, and it will make your day. However you feed your soul, find a way. Okay? Take care, everyone, and look forward to seeing you on Thursday. Bye-bye.